Hi there, I'm Dr. Kara Amstutz. I'm a veterinarian who focuses on pain management and rehabilitation for dogs and cats. And what I want to talk to you today is about cruciate disease in dogs. And first thing we need to talk about is the anatomy of cruciate disease. So first thing, I happen to have a knee joint here in my pocket, and I'd like to go over this with you. So when we think about a dog's knee joint, it's made up of several things. So this is the femur, or what would be our thigh bone. This is the tibia, which is our shin bone. And in between those two bones makes up the knee joint. Inside the knee joint, there is a very thick pad here. It's called the meniscus, and that acts as like a shock absorber for the knee. Every time the dog takes a step, it helps to provide some cushion between these two bones. Inside the knee joint are two ligaments called the cranial and caudal cruciate ligament. The cranial starts at the front and kind of works its way back, and the caudal starts in the back and works its way forward. And they crisscross inside the knee joint to provide stability to the knee. So, out of those two ligaments, the one that seems to cause the most problem are the cranial cruciate ligaments. And what we know about that ligament is that it's responsible for many things. It is responsible for preventing hyperextension of the knee. It prevents too much internal rotation of the lower part of the leg. It also acts as a proprioceptive ligament to help the brain understand where the foot is in space. And it also prevents what's called drawer. Drawer is when, let me step a little closer again. Drawer is when every time the dog takes a step down, the femur, or the front of the top part of the leg, wants to go backward, and the tibia, or the lower part of the leg, wants to go forward. And so that cruciate ligament, the two of those together, help to prevent the tibia from just going too far forward. When that cranial cruciate ligament gets ruptured, it causes the femur and the tibia to hit in all the wrong places and causes damage inside the knee. It can cause the meniscus to tear, it can cause arthritis to form, and it's painful. And the way that I like to describe the cruciate ligament is if you think about a rope, a nice new rope, where all of the fibers are coiled tightly together. They're all going in the same direction. It's very strong. But if you have a rope for a long time and it sees some wear and tear, a strand will get broken here and there, another strand will get broken, and eventually that rope loses its strength. Well, if you think about the cruciate ligament, if we have a patient who has kind of a chronic brewing inflammation going on in the knee, which that's the typical way that we see cruciate disease in dogs. In people, most of the time you have a healthy ligament, there's some sort of an injury, and then you have an unhealthy ligament. In dogs, we know that it's more of a slowly progressive, smoldering inflammation that will eventually make those ligaments of that, or the strands of the ligament, tear one by one. And it's a really common history for me to hear clients say that, you know, my dog ran after a squirrel and came back limping for a day or two, but then he was better. And then a couple of months later, he saw a deer and took off after that and was limping for maybe 3 days, and then he was better. And then another time he was playing out in the yard with a neighbor dog and was cutting back and forth really fast, and he was really limping, so I took him to my vet and they gave me some pain reliever, and then he was okay. This kind of waxing and waning, painful, then okay, painful, then maybe some rest and some pain meds, and then they were okay. That's very common, and that's because over time, a few of those strands of that ligament are getting broken, and eventually the dog loses enough that the knee is now unstable. And then that's when we need to talk about what can we do to slow down this problem or fix it. In people, what we know, we're all built really straight up and down, right? So when a human has this injury, yes, it hurts, but the thing that I hear people say is every time they take a step, it feels like the lower part of their leg is just going to give out, okay? And so it's really just awkward and kind of unsettling to feel like your leg is going to give out. But in dogs, they're built quite differently than we are. and they're built like this, like they're always in a squat, and also like they're walking around in high heels. So if you can imagine when your tibia is going this way and your femur wants to go this way, how much strain that is on that knee, and why this is such a common issue in dogs, and also why they may not want to use that leg, okay? If every time they go to put weight on it, it feels unstable, dogs have 3 other legs, so they can just shift their weight around and not use that leg if they don't have to. And that's why a lot of dogs, when they come to me, they've already lost quite a bit of muscle mass because they've just chosen not to use that limb. So that's, in a nutshell, what cruciate disease is. And in the next video, what I want to do is talk to you about what are some of the treatment options for your dog.